Thank you, Madam Speaker, and through you to the members. I rise today in support of H 4773. I'm grateful for the opportunity to speak to you about this important piece of healthcare legislation, and am thrilled to offer my support. It's imperative that our Commonwealth address the critical need for an equitable experience in the birthing process, and this bill does exactly that. I want to thank the Speaker for his commitment to maternal health, my dear friend, the gentle lady from Cambridge, for her leadership and her steadfast commitment to maternal health, patient safety, and equity, as well as the leadership of the gentleman from the North End and the gentleman from Watertown, as well as all of their staff support every single member of their teams in making this day a reality. I also want to thank the gentle lady from Newton, as well as the Black and Latino Caucus, the Women's Caucus, both of their incomparable executive directors and chairs, and the Bay State Birth Coalition and the Ellen Story Postpartum Commission, and our former coordinator for all of their support in advocating for this bill. I know the concept of midwifery care is a foreign one for many, but for my family's history, my generation is the first generation to ever experience hospital births on my mom's side. That is to say, myself and my first cousins were the first to ever be born in hospitals. This is not due to a lack of being able to afford a hospital birth, but due to the color of their skin. My ancestors were not allowed to enter hospitals, and midwifery care was the norm for the segregated Black community. On March 3rd in 1952, my grandmother gave birth to the baby of her family, her fifth birth, my mom, in her home through a midwife at the age of 38, and turned 39 exactly 1 month later. An unconventional age for that time and now, and with none of the medical technologies available at that time. This bill will certify that midwives are highly trained professionals whose holistic and individualized approach to the pregnancy, labor, delivery, and postpartum care is proven to improve physical and mental health outcomes for moms and their babies. Here in Massachusetts, Black women are twice as likely to die in childbirth, all things being equal, and the severe maternal morbidity rate for Latino women is 1.2 times higher than that of their white counterparts. Black women have a 70% greater risk of severe maternal morbidity than their white counterparts, and from 2011 to 2020, here in Massachusetts, the severe maternal morbidity rates of Latino women increased by 8.2%. What should be a joyous moment for Black and brown people when they learn they are pregnant becomes a moment of fear. My college best friend and her husband tried for over 7 years to get pregnant. Finally, as she approached her 41st year of life, she found herself pregnant. She called me, sobbing in tears, fearful that she would not survive her birthing process. This dread and fear eroded the joy and excitement of the moment. And this, sadly, is the reality for far too many Black and brown women, and that should not be the case. Because of this bill, when it's my turn to become pregnant and start my family, I won't have to carry that same fear and dread. The Commonwealth's 2022 Special Commission on Racial Inequities and Maternal Health report noted that birthing centers and midwifery care help to reduce the rate of death for Black and Latino women during the birthing process and also for their children. It is important to note that it is no fault of Black and brown women that we experience poor outcomes in the birthing process. It is a direct function of systemic racism, institutional racism, and environmental racism. The neighborhoods that we were redlined into, the dismissal of our concerns and doctors' visits by over 82% of medical professionals due to unconscious bias, and the microaggressions and exclusionary behaviors that we experience in the workplace are examples of each of these forms of racism. This is what is killing Black and brown folks in the birthing process. And while we could just shrug our shoulders and wring our hands to say addressing racism is too big, we are taking action to tackle these issues today. To all of my colleagues, this is a monumental bill for birthing equity and justice in our Commonwealth, and I ask that you join me in voting yes on H 4773. Thank you.